years ago. Was it 2 or 3 years ago?
Right.
2.5 years ago. So I walked down to Children's Hospital, and it's sure changed since I was there the last time, and walked through some of the labs and the testing with this group, and said we'd give them a couple $1 million as long as they agree to work together. And they've done a beautiful job of working on this issue of asthma. And my little buddy here, Laura's a perfect example of where the efforts on asthma have really paid off. So this will be her first year where she's not been hospitalized because of this problem. The hospitals have worked together fundamentally to come up with ways to keep children out of the hospital. And it's working out. And there are now more things that they believe they can do with additional protocols that will allow them to more effectively deal with the problem of asthma. But as we were kind of walking around the table here, what I've learned is that this issue of pneumonia for children is a giant and very serious issue, and it needs to be dealt with. And these doctors, all of them here, are confident that we can make great progress on the issue of child pneumonia. I mean, if you think about that, for all of you that are here, most of you have children, think about how scary it would be to have your child with pneumonia. You know, you go down to that hospital and you're holding your breath about how's it going to go, doctor. So they think that they can make some major breakthroughs in that as well. So we're going to give them an additional $2 million that will be funded through Greg Moody's and John McCarthy's program, Health Transformation and Medicaid, to make an additional $2 million available to them. And there's a number of really good things that come from this. First of all is the collaboration between the hospitals. That is really a big deal. Secondly, this group of people have been able to work with the insurance companies to say that if we can make savings, that in fact we can share those savings, and we have a win-win. Fewer hospital visits, less revenue, more revenue for insurance companies. Why don't we have a win-win in our country with people working together? At Children's Hospital here in Columbus, they've even gone one step further, which is a process of what's called capitation. And those rates get set, and then the hospital gets paid a set amount, and if they can perform better with high quality, they get to keep the savings. What does that mean? That means that they're working to make sure that quality medicine is practiced as opposed to sometimes what we will see in a lot of hospitals, quantity medicine, because the system sort of leads us to quantity as opposed to quality. Now, I've said this over and over again. I don't know that people understand. You know, there's, of course, a raging controversy around Obamacare, and what do we do? And frankly, that's what happens when one party tries to jam something through without being able to get both parties to understand the need to solve the problem. It's something that, of course, plagues our country, and we see it in healthcare. I believe that this process that these folks, the adult hospitals, the insurance companies are now pursuing in Ohio, which is called payment reform, where we are now designing a system where we will work more towards keeping people healthy on a quality basis rather than a quantity basis, is a significant part of the answer to our healthcare problems in not only in Ohio but also in the country. You know, we see healthcare costs have kind of leveled off here lately, but you know, just like gravity, we're certain that they're going to continue to rise. And so if we're going to come up with big fixes to healthcare, then we have to fix the way that the incentive system works in the marketplace. And an ability to have a system that measures quality, that provides for greater transparency. You are as likely to ask a hospital or a doctor what a procedure costs as you are likely to ask your minister what his pay is. Nobody here knows what anything costs, and the ability to develop transparency, shopping for quality care. And that doesn't mean that we have a race to the bottom. It means we have a race towards quality, with quality being measured. And you have to understand that we've been able to chart a process whereby we know some of the highest cost hospitals in our state versus some of the lowest cost hospitals, and what the quality is of each of them. And it is amazing how the quality can be favorably compared. And so we are engaging now in an extensive effort to try to work with both the providers, which are, of course, the hospitals, the whole healthcare system that treats us, along with insurance companies. And I would say that's comparable to probably trying to get to Hatfield and McCoy's to come together. But frankly, I think that both healthcare providers and insurance companies realize that it's going to be necessary for them to work together. But these are the tip of the spear. These folks are the tip of the spear. They've done everything that we could possibly ask. They work together. They share results. They work with the insurance industry to make sure that that when we have high quality and low prices, that everybody wins. Patient, the providers, and the insurance companies. I mean, it's all terrific. And you know, it's just such a deep pleasure for me to be able to work with all of these folks, these doctors. You know, you've got cardiologists, children's doctors who study the heart, children's doctors that study the lungs, children's doctors who study infectious disease. I mean, these people have their life dedicated to this. They're doing their research. It's just so fantastic. And